Vitamin D has become a household name in health discussions, particularly when it comes to immunity. Often called the sunshine vitamin, it plays a central role in supporting the immune system, bone health, and overall well-being. In recent years, the conversation around vitamin D supplementation has intensified, fueled by studies linking deficiency to increased susceptibility to infections, seasonal illnesses, and chronic conditions. While media headlines sometimes imply that everyone should supplement year-round, the reality is more nuanced. Understanding who benefits most, how to optimize dosage safely, and when testing is appropriate can help people harness vitamin D's advantages without unnecessary worry or risk. Vitamin D's importance lies in its multifaceted role in immune regulation. It enhances the body's ability to respond to pathogens while also modulating inflammatory responses, creating a balance that helps prevent overactive immune reactions. Research shows that adequate vitamin D levels are associated with a reduced risk of respiratory infections, improved vaccine response, and potentially milder outcomes in certain viral illnesses. For people with low baseline levels, supplementation can correct deficiencies and significantly improve immune resilience. This makes vitamin D an especially valuable tool during winter months when sunlight exposure is limited, or for populations who spend most of their time indoors. However, not everyone requires year-round supplementation at the same dose. Individuals at higher risk of deficiency, including older adults, people with darker skin, those living at higher latitudes, and individuals with limited sun exposure, stand to gain the most benefit. Certain medical conditions, such as osteoporosis, malabsorption syndromes, obesity, and chronic kidney or liver disease, can also reduce vitamin D levels, making supplementation crucial. For these groups, consistent supplementation, guided by healthcare advice, can support not only immunity but also bone density and muscle function, contributing to overall health and quality of life. Testing vitamin D levels can be an effective way to personalize supplementation. A simple blood test measuring serum 25-hydroxyvitamin D provides clarity on whether a person is deficient, insufficient, or within an optimal range. Based on these results, healthcare providers can recommend a dosage that corrects deficiency without exceeding safe limits. While some people may benefit from a moderate daily dose year-round, others may need higher doses temporarily to restore adequate levels before transitioning to a maintenance dose. Personalized supplementation prevents unnecessary intake while maximizing the vitamin's benefits, emphasizing that thoughtful, informed use is more effective than blanket recommendations. Dosage guidelines have evolved as research accumulates. For many adults, daily intakes of 600 to 800 IU are often sufficient to maintain normal levels, but higher doses, up to 1,000 to 2,000 IU per day, may be recommended for individuals at risk of deficiency, especially during winter months or periods of limited sunlight. Importantly, vitamin D is fat-soluble, so taking it with meals enhances absorption. Excessive intake can lead to toxicity, though this is rare when supplementation is within recommended ranges. These nuances illustrate that supplementation is most beneficial when tailored to individual needs, rather than taken indiscriminately. Beyond correcting deficiency, vitamin D may enhance daily well-being in subtle but meaningful ways. People with sufficient vitamin D levels often report better energy, improved mood, and greater resistance to seasonal fatigue, creating a ripple effect on productivity, exercise capacity, and overall lifestyle quality. In this sense, vitamin D supplementation is not only about preventing illness, it can also support vitality and daily function, particularly in populations with limited sun exposure. Another positive aspect of vitamin D supplementation is its accessibility and affordability. Unlike some interventions that require complex procedures or costly medications, vitamin D is widely available in over-the-counter tablets, capsules, gummies, and even fortified foods. This ease of access, combined with a generally strong safety profile when used appropriately, makes it a practical preventive tool that can be integrated into daily routines without significant barriers. It's also worth noting that vitamin D works best in combination with other health-supporting behaviors. Adequate sleep, balanced nutrition, regular physical activity, and stress management all contribute to robust immune function, and vitamin D complements rather than replaces these strategies. When taken as part of a holistic approach to health, supplementation can amplify overall well-being and help people feel more resilient during challenging seasons, such as winter or periods of heightened infection risk. In conclusion, vitamin D supplementation offers significant benefits for immune health, particularly for individuals at risk of deficiency or with limited sun exposure. While not everyone requires the same dose year-round, testing and personalized guidance can ensure that supplementation is both safe and effective. Beyond immunity, vitamin D supports energy, mood, bone health, and overall vitality, making it a versatile and valuable component of a healthy lifestyle. Far from being a one-size-fits-all solution, thoughtful vitamin D supplementation empowers people to take proactive steps in maintaining health, strengthening resilience, and enhancing day-to-day well-being.